Today we're going to be looking at this paper on BQ1.1 as well as this paper. So far we've looked at Omicron, Delta, Omicron subvariant BA1, Omicron subvariant BA2, we've looked at Omicron subvariant BA5, and now we are looking at Omicron subvariant BQ1.1. Now there's not a ton of literature out there on the BQ variants, so I had to get a little creative looking at clinical studies. This first one is a double-blind control study for first-in-human phase 1 trials. It was done in South Africa and Brazil across 11 centers. Infection with COVID was confirmed with PCR, and people had mild to moderate symptoms. Viral load was analyzed from using both nostrils and a nasopharyngeal swab, and samples were collected during 2 periods, the first between December 1st, 2021 and May 23rd, 2022, and the second between July 20th, 2022 and January 4th, 2023. Now, while they collected data at days 1 through 29 at varying intervals, we have to wait until next year in 2024 for them to release the data, so we don't have that. And our BQ1.1 in this study only accounts for about 30% of the variants they tested. So our placebo group, which is our untouched BQ controls, is around 29 participants, give or take, where they're looking at the percentage of patients within the study samples that have symptoms resolved by day 8. And in their drug trial, you have the drug having a high efficacy with about 40% of patients having their symptoms resolved by day 8. But what's important here is that by day 8, only about 20% of people have their symptoms resolved. So without treatment, this means that 80% of these placebo patients are going to still continue on with symptoms past day 8. Moving on to the next study, we're looking at the BQ1.1 again, and this is a multi-center observational cohort study between December 7th, 2021 and December 15th, 2022. The important takeaway from this study is that there's no significant difference between the Omicron sublineage groups regarding the severity of the disease at ICU admission, which is showing that the symptoms are not getting milder as the virus mutates. Now, this study is a sub-study of the SEV-RVIR study based out of the Greater Paris area in northern France, where the BQ1.1 group is sort of a compilation of BF5, BF7, CE1, BE1, BQ1, and BQ1.1, where we have 47 of the study participants in this group, with them also looking at the BA4 and 5 groups and the BA2 group. So that's all part of the same lineage. Now, interestingly, the median time interval between first symptoms and ICU admission was significantly shorter in the BQ1.1 group than in the other test groups that they looked at, where the median days between symptom onset and ICU admission was 3 days for the BQ1.1 group versus 4 and 7 days for the other test groups. What this indicates is that the BQ1.1 variant has become more efficient at making people sicker faster. However, while it's more efficient at making people sicker faster, there's no significant difference between the severity of the disease at ICU admission, where among all the groups, about a quarter of the patients had to be intubated within 24 hours of ICU admission. An interesting note is that the BQ1.1 group had a significantly shorter duration of ICU stay than those from the other two groups, 6 days versus 7 and 11, and this is the median day. But again, just because it's a shorter duration ICU stay doesn't mean that they're not continuing to have COVID and being infectious and transmissible for only that period of time. You're going to be transmissible and have COVID for longer. It's just you're not required to be on ventilation during that time or to be in the ICU at that time. So when we're looking at the BQ1.1 group, it's showing that COVID has evolved to be more efficient and effective at what it does, making you sicker faster, and it is not showing that it has gotten milder in any sense of the word.